Eardrops seem simple, but one wrong move could mean they don't work at all. Here's exactly how to use them right for both kids and adults. Step 1. Always check the label and expiration date before you begin. Read the instructions carefully. Dosage and directions may differ for children and adults. Wash your hands thoroughly to help prevent introducing germs into the ear. If the drops are cold, warm the bottle in your hands for a minute. Cold drops can cause dizziness or discomfort. For adults, lie on your side with the affected ear facing up. Gently pull the outer ear up and back. This helps straighten the ear canal. Slowly squeeze the prescribed number of drops into the ear. Avoid touching the dropper tip to the ear. Stay in the same position for 3 to 5 minutes so the medicine reaches deep into the ear canal. If your healthcare provider recommends it, gently press the small flap in front of the ear, the tragus, a few times to help the drops move into the canal. Now here's what's different for children. For young children, gently pull the ear down and back because their ear canal is shaped differently. Have your child lie comfortably with the affected ear facing up. A favorite toy, story, or soft song can help your child stay calm and still. Give the exact number of drops recommended by your doctor or pharmacist. Keep your child in the same position for 2 to 5 minutes so the medicine has time to work. If needed, place a small cotton ball loosely at the entrance of the ear, but never push it into the ear canal. Always complete the full course of treatment, even if symptoms improve sooner, unless your healthcare provider tells you otherwise. With the right technique, eardrops can work safely and effectively for the whole family. Stay well. Subscriber for more health tips.